For my Genius Hour project, I chose to do transcranial magnetic stimulation, also known as TMS. Magnetic stimulation has been around for a long time. It was discovered in 1790 by Galvani and Volta, while electromagnetic induction was discovered by Michael Faraday in 1831. However, TMS wasn't developed until 1980 and wasn't FDA approved until 2008. So, what is TMS? TMS is a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain to improve symptoms of depression. However, it is also useful in improving other illnesses. As you can see in this picture, the electromagnetic coil is placed on your head and sends magnetic fields into the proper area of your brain. During a TMS session, the first thing that happens is the placement of the electromagnetic coil. Next, the patient's motor threshold must be reached. This is the amount of power necessary to make your thumb twitch. Once the first two steps are completed, the magnetic field pulls neurons to the surface, forcing them into action potential, causing an increase in neuron firing. Once the neuron firing is increased, there is an increase in neural pathways, which equals more positive thoughts. The overall magnetic field only lasts 100 to 200 microseconds at 1.5 to 2 Tesla. This slide highlights what happens during treatment in more simple means. However, treatment lasts about 40 minutes, 5 days a week for 4 to 6 weeks. This picture shows a patient receiving TMS. However, the only step that has been taken is to ensure the coil is placed correctly. NeuroStar is a huge name when it comes to TMS treatment. They're the ones that make the big money in TMS treatment. This slide shows the side effects of electroconvulsive therapy and vagus nerve stimulation. The purpose of this slide is to show that TMS has less side effects and is less invasive than the other two. Electric convulsive therapy works by sending electric currents through the brain, triggering a seizure, causing a change in brain chemistry. However, ECT can produce headaches, upset stomach, muscle aches, memory problems, and afterward seizures. Vagus nerve stimulation is when a device is placed under your skin and it sends electrical pulses through the vagus nerve. Then it sends messages about mood, sleep, and other functions to your brain. The bad thing about this procedure is that it can produce voice changes, coughs and sore throat, neck pain, breathing problems, and difficulty swallowing. This proves that TMS is the best treatment overall. TMS does have some side effects, but they are only common in a small percentage of patients. Only 1 in 3 patients experience a sore scalp. Sensations and facial twitchings can also be side effects, but they can be fixed by changing the coil placement. Another unpleasant side effect could be a headache. The highest risk side effect, but lowest experience rate, is a seizure. This picture above shows all the different types of coils that can be used during TMS. This diagram highlights the side effects from drug therapy compared to the side effects from TMS. Bernardi, would you rather drug therapy or TMS therapy?
TMS therapy all the way.
What can TMS treat? TMS can treat depression, anxiety, PTSD, obsessive compulsive disorder, schizophrenia, substance abuse, and PDD. Who cannot get TMS? Patients with aneurysm clips or coils, implanted stimulators, cardiac pacemakers, metallic implants, facial tattoos, or any metal devices near your head cannot receive TMS. So, what is the diagnostic process? I interviewed Dr. Schlickman of Worcester TMS, and he gave me a broad idea of what the diagnosis is. He told me that first, a diagnosis of major depression needs to be made. Next, a clinical physician must give a PET screening. And there has to be a failure of antidepressants, and it has to be more than one failure. PET scans look to highlight glucose and oxygen levels, which are used as our brain's fuel. To classify a depressed brain, you can look for it to be much darker and much less active than a not depressed brain. These two pictures highlight the differences of a depressed brain compared to a healthy brain. For this project, I chose to focus more on TMS depression because it is the #1 illness treated by TMS. Below are just some facts I've included about depression with TMS. Patients can resume normal activity after treatment. Patients have a magnet placed on their head, which is used to reset their mood regulatory system. TMS is specifically designed for patients who did not respond to any antidepressants. Another good thing about TMS is it targets deeper areas in the brain, like the nucleus accumbens. This helps when resetting the regulatory system of moods. I interviewed Dr. Schlickman of the Worcester TMS facility, and he explained to me the conditions necessary in order to receive TMS treatment. He went into further detail about insurance carriers covering TMS treatment. Again, he focused on the failure of antidepressants in order to receive TMS. Another question I pitched to Dr. Schlickman is how you decide what area of the brain to stimulate. Dr. Schlickman indicated that the left lateral prefrontal cortex shows success with fast TMS, while the right lateral prefrontal cortex shows success with slow TMS. I asked Dr. Schlickman a wide variety of questions, but chose to include two which I thought were more beneficial to my project. The first question I asked him was, do you think it is ethical to initiate the placebo effect with TMS treatment? And if so, why? The placebo effect is a controversial phenomenon in which a fake treatment can sometimes improve a patient's conditions simply because the person has the expectation that it will be helpful. Dr. Schlickman agrees that the placebo effect is very controversial and said that the placebo effect is an issue in all aspects of allopathic medicine. He also agreed that no one should be tricked or not receive treatment based on a research study. Another question I asked him, which I thought would deliver a good response, is what is the best case or experience you have had with TMS? Dr. Schlickman explained how he was very fortunate to watch many patients improve over the weeks. Schlickman describes how he helped a patient who didn't respond to treatment for 3 months, and then eventually he started improving. Now that patient brings his cousin in for treatments, and she has suffered her whole life as much as he has. Dr. Schlickman has worked with both of them and has improved their symptoms drastically.